Right now, in your medical headlines this morning, there is a national shortage of more than 320 prescription drugs. It is the biggest one we've ever seen, and it's having a big impact on inpatient and hospitals' medications. KVUE's Eric Pointer spoke to a pharmacy professor with the University of Texas. He joins us now in studio. Eric, what types of medication are in short supply right now?
So, Hannah, there are many pretty big ones that you'd recognize, things like the fluids for the IV bags next to the hospital beds, which the professor I spoke with says is concerning because they use those for nearly every patient who enters the hospital. Also, another one is a strong pain medication that they use for surgeries. Fentanyl, which can be deadly in the streets, but it's a big tool when used properly in hospitals. She also says that there is a shortage of certain chemotherapy agents, and she says that most hospitals have a plan in place to deal with the shortages. But if you have a procedure coming up and are concerned, don't be afraid to ask questions.
When can it occur? When should it occur? Sometimes you need those faster than other times. And then also, it's not a bad idea to ask about drug shortages. Are they going to use alternative medicines if their primary medicines are not available?
And we also checked in with our local hospitals to see how they were handling the shortages. None wanted to give an on-camera interview, but some sent statements. A statement from Baylor Scott and White Health said, "We are aware of shortages and we continue to monitor the situation, working closely with vendors and distributors. Across our organization, multidisciplinary teams work to make sure we have adequate supplies to care for patients." And one from representatives from St. David's Healthcare said, in part, "The health and safety of our patients continues to be our highest priority, and we continue to implement strategies to ensure all our patients are receiving medication safely and effectively." Now, later on this morning, you'll be able to see that full statement from St. David's Healthcare representatives on our website, KVUE.com. And I did reach out to representatives with Ascension Hospital. They told me that they would look into my request, but they didn't provide any additional information.